I'm Simo Nikkari. I'm a medical doctor by training. I've specialized in clinical microbiology and administration, but I've worked in the university setting, in primary health care, in hospitals. Then I have an academic background. I'm a adjunct professor at the university in Turku in Finland, and currently I'm a professor at the Center for Military Medicine and the Center for Biothreat Preparedness. I have worked in the field of One Health in the sense that I led the CB Defense and Environmental Health section of our institute, and that brings together animal environmental health and human health. And coming from Finland, we have the strategy to secure vital functions of society. So we have for years been working in a similar setting. We just do not call it One Health. It's a whole of government approach, which is it's even wider than what is considered One Health. So the global health security agenda is an alliance of more than 50 countries, as well as international organizations, including WHO, OIE, FAO, but also the World Bank and organizations like Interpol. Traditionally, the human health sector, animal and environmental sector, they have been working in silos. But the GHSA brings together the animal, human, and environmental health sectors so that in combating against infectious diseases, it's done together. And I think that the Ebola epidemic in West Africa was a good example on how all sectors have to work together. And things like antimicrobial resistance, and it's for the first time it's done together. Yes, because the infectious diseases see no borders, and the response against them should be done in a multisectoral way between the human health and the animal environmental health sectors. And of the emerging and re-emerging diseases, 2/3 are zoonotic in origin, meaning that they infect animals and spread between animals as well as between animals and man. So the disease burden is in the environment. And that's why the human health sector has to work together with the animal environmental health and wildlife experts to combat these threats. Health security is a global public good that is first and foremost based on actions at the national level. The need to strengthen country capacities to prevent, detect, and respond to all hazards is an integral part of the Agenda 2030, and it is underlined by the WHO International Health Regulations, the OIE standards, and the UN Sendai framework for disaster risk reduction. Capacity building requires country ownership and a One Health approach. Health security involves a variety of sectors such as animal and human health, agriculture, defense, development, environment, food safety, planning, public safety, tourism, trade, and transport. The lessons learned during the GHSA assessments have now been used in developing the WHO Joint External Evaluation tool, and the same processes that were developed for the GHSA are now utilized in the JEE's Joint External Evaluations. And that is a model of a One Health approach, not only One Health, but a whole of government approach against potential risks to human health, not only infectious diseases threats, also radiological, chemical threats that are covered in the JEE. One of the consistent findings in first the GHSA assessments and now the joint external evaluations is that government sectors work in silos. This process brings them together. It brings human health, environmental health, animal health, the security sector, biosafety, biosecurity, even defense. It brings them all together because the threats are such that they should be handled in a multisectoral way. So the joint external evaluation, it's called joint because there's a self-evaluation followed by the external evaluation, which validates the findings of the self-evaluation. So the JEE is just a beginning for the country. So the JEE is voluntary, it's based on the country's needs, and it's the beginning for countries a national action plan to improve their capabilities to prevent, detect, and respond to threats to human life. Yes, the JEE Alliance is an alliance of countries and international organizations, and it's a platform for facilitating multi-sectoral collaboration on health security, capacity building, and international health regulations implementation. The alliance supports WHO in many ways. First of all, it supports the involvement of in other international organizations, namely FAO, OIE, in the process, and so that was the first mission of the alliance. The other mission of the alliance is to bring resources for continuation of the JEE evaluations, and the major task, and that is why, for example, the World Bank is involved, is to support the countries in filling the gaps that have been found or identified during the evaluations and develop costed national action plans to fill those gaps and find domestic resources, allocate domestic, but also to find other resources to fill those capacity gaps. The role of the country is crucial. This all comes, the JEE is voluntary, and that's why the evaluation is based on consensus. The country owns the report. The report is made public so that potential financing institutions could utilize it so that the needs and those who can support those who are in need and those who can support, they could find each other. But the country owns, and it's made for the country, and the Alliance and WHO support the country in developing the national action plan. So what I have personally found very motivating in this process, I have participated in many similar international processes, and we are really getting things done. In 1 year, 28 countries have now undergone an evaluation. 2 countries are finishing their national action plans. There is financing for these countries. The countries are active, they are motivated. I think this is a very good basis for developing sustainable growth, and especially in developing countries. Having said that, we have evaluated also developed countries, and there is certainly room for improvement. And of course, it is a confidence building measure if developed countries undergo a JEE, but in practice, the countries have found it very useful. So building national health security capacities is difficult. It's a difficult process, but I think we have now a good tool to improve that. And the JEE is like glue. It brings together all previous and other assessments and knowledge. And it's not a deep dive in itself, but because it brings the PVS evaluation, other information, we gather information during the self-evaluation, we utilize that together in good collaboration with the best country experts. And that is the power of the JEE.